I'm here today to announce the decision on the future of VA's electronic health record, otherwise I call it an EHR. I wanted to say from the outset that when the President had selected me to be Secretary, that he made clear that it was his expectation that we were going to be doing things differently and that we were going to be making decisions like a business, and that includes this issue of the electronic health record. I had also said previously that I would be making a decision on this by July 1st of this year, and I'm honoring that commitment today by sharing that with you. As you know, the health and safety of our veterans is our top priority, and having a complete and accurate comprehensive medical record is critical to the health of our veterans and to the safety of their veterans. I do want to start before I announce my decision by saying that I am extremely proud of VA's longstanding history in IT innovation. It actually began and really started the whole electronic health record in this country with a group of very courageous VA clinicians who were in their basement innovating because they saw a way to take better care of their patients. And they did it without authorization, and so that's why I call them courageous. But eventually, their work took hold, and this became our VISTA system today. So we have a very long tradition of leading in this part of the country. And it was their achievements in developing VISTA that led both VA clinicians and researchers to perform and have VA's clinical performance be better than or certainly lead in the area of clinical quality improvement and patient safety, including the first medication bar-coded system that now every hospital in the country takes advantage of. That having been said, that was a long time ago, and our VISTA system today is in need of major modernization if we're going to keep pace of what's happening in healthcare and all the advances that are going on, not only including clinical needs and technology, but also cybersecurity, which you know is increasingly becoming important. I've also said that software development is not a core competency of VA, nor do I think that it should be. And I told Congress recently that I was committed to getting out of the business of software development. I didn't think that remaining in that business was a benefit to veterans. And so because of that, we're making a decision today to move towards a commercial off-the-shelf product. I didn't come to that decision lightly. I've spent the last several months since becoming secretary reviewing numerous studies, reports, and commissions on this topic, including the recent Commission on Care report, which recommended moving towards an off-the-shelf product. I've spent time talking with our clinicians in VA, and as you may know, I actually use the VISTA system myself as a practicing physician in the VA. In addition to that, I've consulted with chief information officers from around the country, and I've met personally with chief executive officers from some of the leading health systems in this country to get their thoughts on where IT was going and what we needed to do in the VA to make sure that we modernized our systems. We've actually had reports from management consulting companies that were done on this specific topic, giving us their recommendations, and numerous reports from the Government Accountability Office and the Inspector General on VA's IT systems. I counted no fewer than 7 blue ribbon commissions and large numbers of congressional hearings calling on VA to begin to act differently when it came to IT and asking us to modernize and to work in different ways. At VA, we know where almost all of our veteran patients are going to come from. They come from one place, the Department of Defense. And for that reason, Congress has been urging VA and the Department of Defense for 17 years. I can trace this back to 2000. I'm sure somebody could find even before that when Congress had been talking about this. They've been urging us to work more closely together on these issues as federal entities with the same customer base. To date, as you know, VA and DoD have not adopted the same electronic health record system. Instead, we've worked together over the years to advance interoperability, but we still have separate applications. We've spent hundreds of millions of dollars trying to make these applications talk together, all with the intent to have a consistent, accurate medical record for our customers. And while we did establish interoperability in April 2016 between VA and DoD for key aspects of the record, it really is read-only at this point. And still, the ability to provide seamless care with different information standards between the organizations, separate changes of command, complex governance in each organization, separate implementation schedules that have to be coordinated, make this a challenge for us to do for our veterans. And the bottom line is we still can't trade information seamlessly for our veteran patients and seamlessly execute a shared plan of care with smooth handoffs. Without the ability to improve and consistently implement this through national interoperability standards, which still are not existent, VA and DoD is going to continue to face significant challenges if these departments remain on two different systems. For that reason, I've decided that VA will adopt the same EHR system as the Department of Defense, known as the MHS Genesis, which is at its core a Cerner Millennium product. VA's adoption of the same EHR system as DoD will ultimately result in all patient data residing in one common system that will enable seamless care between the departments without the manual and electronic exchange and reconciliation of data between two separate systems. It's time to move forward, and as Secretary, I was not willing to put this decision off any longer. When the Department of Defense went through their acquisition in 2014, they looked at a large number of factors and did a lot of work. And the acquisition process, starting from requirements to the contract award, took 26 months. We simply can't afford to wait that long when it comes to the health of our veterans. Because of the urgency and critical nature of this decision, I've decided that there is a public interest exception to the requirement for full and open competition in this technology acquisition. Accordingly, under my authority as Secretary of Veteran Affairs, I've signed what is known as a Determination of Findings, or DNF, that is a special form of written approval by an authorized official that is required by statute or regulation as a prerequisite to taking certain contract actions. The DNF notes that there's a public interest exception to the requirement for full and open competition that determines that VA may issue a solicitation directly to Cerner Corporation for the acquisition of the electronic health record currently being deployed by the Department of Defense for deployment and transition across the VA enterprise in a manner that meets VA's needs and will enable seamless healthcare to veterans and qualified beneficiaries. Additionally, we've looked at the need for VA to adopt significant cybersecurity enhancements, and we intend to leverage the architecture, tools, and processes that have already been put in place by the Department of Defense to protect their data, to include both physical and virtual separation from commercial clients. This DNF action is only done in particular circumstances when the public interest demands it, and that's clearly the case here. Once again, for the reasons of the health and protection of our veterans, I've decided that we can't wait years for the EHR acquisition process to get the next generation in place. Let me say what lies ahead, as this is just the beginning of the process. VA has unique needs, and many of those are different from the Department of Defense. For this reason, VA will be adopting the identical EHR that DoD uses, but, and this is an important but, with additional capabilities to maximize interoperability with our community partners. So we're going to be on a similar platform using the Cerner platform, but it is critical that we achieve interoperability with our community partners because so many are using other systems, and that is essential for the health of our veterans. VA clinicians will be very involved in how this process moves forward and in the implementation of the system. If anything we've learned in VA is that if you don't do this with clinical involvement, that it won't work. And so we're going to not forget how we got to where we got in VA and the innovation that we have, and we're going to continue to clinically innovate and involve our clinicians. In many ways, VA is well ahead of the Department of Defense in clinical IT innovations, and we're not going to forget that. And our work in in turn will help Department of Defense get better as well. Furthermore, VA must obtain interoperability with DoD and its academic affiliates and community partners, many of which are on these different platforms. Therefore, we are embarking on creating something that has not been done before. That is an integrated product that, while we're utilizing the DoD platform, will require a meaningful integration with other vendors to create a system that serves veterans in the very best possible way. This is going to take the cooperation and involvement of many companies other than Cerner, and thought leaders, all that can serve as a model for the federal government and for the rest of healthcare. Once again, I want to thank the President for his incredible commitment to helping our veterans and his support for our team here at VA as we undertake this important work. This is a very exciting phase for VA, the Department of Defense, and for the country. Our mission is too important not to get this right, and we will. Thank you, and I'd be glad to take a few questions. I thought I was going to get away, Leo, with no questions.
No, thank you, Mr. Secretary. Could you talk about how soon we'll see some results from this? When will veterans notice? And will you need additional money for this move?
This DNF is going to allow us to move right into discussions that will result in a shortened period to get to the details that are going to give us the answers on how much money will be required, what the length of the process is, and how we involve other companies and thought leaders to help make sure that we get this right for veterans. So as I said, this is the beginning of the process. This starts it right now, and those discussions are going to be intensively occurring. And we have brought on extra help, many from the Department of Defense, because we are now working on this together in a way that we've never done before to be able to help get to those answers quicker than if VA were to do this alone. Good morning, Donovan.
Good morning. Sorry, so have you appropriated any money toward this already, or?
Well, the VA, as you know, has a significant IT budget, much of which has been towards the development and the maintenance of new advances in the VISTA system. So this will allow us to begin to start using some of our current resources towards this new process. But there is no doubt that we are going to be working with our appropriations committees in Congress to make sure that we have the resources to do this right. This is, not only does the DoD have their experience, I've, as a private hospital CEO, done 2 electronic health record transitions myself. This is a tough and important process to do right, and we're going to make sure we do it right.
And then, does this affect scheduling at all, or is this just the
This can certainly have an impact on scheduling as well. We want to make sure that this is an integrated system. The scheduling needs of VA are an area that are somewhat different than DoD's. So when we talked about a common platform meeting unique needs of VA, this scheduling will certainly be one of those areas that are different. Thank you. Great. We will be having further discussions on this and give people a chance if they have additional questions, which I know Leo and Donovan will, this afternoon at the White House at 1:30. So be glad to entertain additional thoughts at that time as well. Thank you very much.